Hey everybody, I'm John Hammarley, and this is theplasticsurgerychannel.com, where there is everything to talk about and learn from as far as plastic surgery is concerned. I want to know from you, Dr. Hughes, biggest misconception that patients have, or the top three.
One free, pick one.
I think from a global perspective, I think people have a misconception of plastic surgery. I mean, they always have, right? It's always been a little taboo. I think we're getting better with that with more social media involvement, and people are becoming a little less wary of, diving into our waters, so to speak.
I like that, the taboo. I think the biggest misconception I see from a patient side is that they don't have to do any maintenance. I think that's a really interesting thing where people are like, well, no, I didn't want to diet and exercise. That's why I did the tummy tuck. And I'm like, no, you're still going to have to work out and maintain these results. I think from a patient side, that's the biggest misconception I see is from that perspective.
On a specific note, I don't know if you get this, people think that fat is really smart. So they say, if I'm going to get liposuction, I heard it's going to grow back here, or something like that. So I think the misconception of fat after liposuction, that comes up a lot.
Yeah.
Social media, has it helped or hurt as far as having informed patients?
I think it's helped in the sense that for me, it's been a conversation starter, because they come in, they're more educated, or at least they think they're educated, but again, at least it's more of a dialogue as opposed to this, paternalistic, patient-doctor relationship. It's a little bit more interactive.
Yeah, I think that conversation starter, I think, is a really good point, because then you have a starting point, because they're coming in with questions that are maybe a little more educated. So I'm a little less, global perspective on what we're talking about, and I can narrow it down. So I think it does help as a patient education tool when it's used appropriately, of course.
And also when they come in with, celebrity pictures or things like that, or what their wish pics, it also stimulates the conversation of telling them what is airbrushed and what's not realistic, and what's real and what's achievable and what's not achievable.
Thanks, guys. Appreciate it. For more information on anything, misconceptions that you want to debunk or actual truth about different procedures, go to theplasticsurgerychannel.com.